This is our anaphylaxis kit. We're going to talk about what's in the kit, the dosing and the instructions, and then we're going to talk about the specific things that we have in the kit. Everything that you would need for an anaphylaxis reaction should be in this kit. So we're going to start out where you can look at what we have on the cover here. It tells you exactly what drugs are in this kit. And it talks about the dosing, so you know specifically what needs to be dosed for the adult doses versus the pediatric doses. We have on here the routes, IM or IV. Note that almost every drug here is given IM. There's only one drug, specifically ranitidine, that is given IV. And here we have in the other, it talks about some of the comments specific to the drug, such as repeat every 5 to 15 minutes or doses specific to ages. Over here shows where the epi would be given in the thigh, and this is both for adult and pediatric, and over here is the non-epi medications, and those would be given in the shoulder. So the first thing you'll do when you grab this kit is break off this tag here. So let's go ahead and open this up, and you can see on the cover is exactly what is on the top of the box, so that you know again what's in here and what the doses are. So now we're going to talk about specifically about what is in the kit. Over here you have all the syringes that you would need. Here is a syringe that is specific to ranitidine just because it's a larger syringe. Here we have the needles. All of these needles would be used to draw up the medications. Over here, the ones that are marked IM would be the ones that you would use to actually give it IM. We have alcohol wipes. We, of course, want to make sure that we're using sterile technique when we're mixing medications. We have labels in case you need to mix or you need to label something. Here is our albuterol nebs, and so you would need a nebulizer to give that. And these are some of our IM medications and IV medications. Here is our sodium chloride, and that's used for mixing the ranitidine. Here is our Solumedrol, and we'll show you how to activate that. This one here is our epinephrine, and this will be probably the first thing that you use, and it might be the only thing you use in the box. Please note that this is IM use only, intramuscular, and labeled as so. And our last medication we have in here is our diphenhydramine or our Benadryl. So at this time now, we're going to show you how to draw up each of the medications. We're going to go ahead and start pulling up the drugs now. We're going to start out with epinephrine. So we alcohol wipe the top, and we'll select the correct size syringe. We have 3 ml and 1 ml. This one we're going to pull up the 1 ml syringe. So we'll use a regular needle to draw up the medication. You attach it without touching. And tap out the air bubbles and draw up the dose that you will be needing. Okay, now we're going to switch to a needle that's used for IM administration, because now you've drawn up the med and now we're ready to give the medication. Okay, so the next medication we're going to look at is the Benadryl. We'll get everything that we're needing. Again, we're going to alcohol wipe the top. select the size syringe that you'll need. Being careful never to touch the end of the syringe to keep it sterile. You always have to inject air into the vial before you draw it up and create a negative pressure. And squeeze out the air bubbles. Again, we're going to switch the needles now because we're going to be giving this IM, so you want to use the correct size needle, and they are marked. Okay. The next medication we're going to use is the Solumedrol, and that's a special vial. You have to activate it. So push down on it. And then swirl it until it mixes. So we have one that's already mixed because it takes actually a couple minutes for it to be completely mixed. So snap off that little top, alcohol wipe it, and this one you're going to select a little larger needle or syringe. Again, note that we always inject air into the vial. Tapping out the air bubbles. And switching to the correct IM needle. Our last medication we're going to be doing is the ranitidine, and that one requires a little mixing. So you have 2 vials. Snap off the NS and the ranitidine and swab it with your alcohol. So you're going to be pulling up your ranitidine, and you'll pull it all up. It's about 2 mils. Inject it into the NS, all of it. And you'll grab your large syringe because you have about 22 mils that you'll be pulling up.